Hi, my name is Elisa, and I'm going to be performing a head-to-toe assessment on my patient Lauren. So I'm going to introduce myself and explain the procedure. Hi, my name is Elisa. I'm going to be your student nurse today. I am going to perform a head-to-toe assessment, a physical head-to-toe assessment. Would that be okay with you?
Yes.
Okay. So now I'm going to do just a general inspection, so I see her posture. I also check for like behavior and body structure. I'm going to also perform vital signs and also a pain assessment. So from a scale from 0 to 10, 10 being the worst pain you ever felt in your life and 0 being no pain at all, how would you rate your pain?
0.
Okay, so there's no pain. We'll document that. And now we're going to go over the questions to see if my patient is oriented and alert. So, do you happen to know where you are right now?
Yes, I am at my house.
Okay. Do you know what year it is?
2022.
Okay, and do you know, could you please tell me your name again and date of birth?
Yes, Lauren Chang 2897.
Okay, so we have my patient is oriented and alert, and I'll document that. And now that we have done the assessment, and I also assessed her speech, and it was not slurred or anything, so we're gonna go ahead and start the physical assessment. We're gonna start up here and then going down to her feet. So first we're gonna do an inspection. We're going to look at the head to see if like everything is symmetrical. So her eyes, nostrils, the ears, mouth, also the pupils, and the neck also has to be like symmetrical. So everything is good. Now we're gonna start right here, and I see I'm going to inspect good hair distribution, no skin, mira por allá por favor. No skin breakdown, and I'm going to palpate now to see to check for tenderness. So do you feel any tenderness or any pain at all?
No.
Okay, so I documented that, and now we're gonna go and do start with the eyes. So we're gonna use the pen light. You're gonna look at my nose, and you're gonna look at my nose and then just stay right here, okay? Okay, so I'm looking for accommodation of the pupils, and then also to see if they react to light and if the pupils constrict. So we have everything, both pupils are reacted to light, so we're going to document that as parallel. They are symmetrical, and I'm going to check for the conjunctiva and sclera. Let me see. Something good. And then I don't see any abnormal findings here either. So we'll document that too. So the shape of the eyes, they reacted to light, and they're both symmetrical and equal. So now we're gonna go ahead and do the field of glaze. So just to make sure that her there's an steady movement and they are not shaking. So could you please look at right here, and we're gonna go up and down, left, right, left. Sorry, and then go here, here. So we'll document that as well. Now we're gonna check the ears. We're gonna pull them up, and then we're gonna check for any drainage, any redness, to see if there's any pain at all. And did you feel any pain when I was doing this?
No.
Okay, so we'll document that as well. And then we're gonna look at the nose as well for the same findings. So we're gonna look for any drainage or any bleeding, any bruises, anything, any abnormal findings. And then now we're gonna go. Now we're going to check the mouth. So I'm gonna have my patient. I'm inspecting the lips, but I'm gonna have my patient saying ah. That way I can see the uvula. Would you please say ah? Okay, so I see the uvula, and then I see that she has her teeth. Her skin inside is pink and moist, and she doesn't have any drainage or any abnormal findings in the mouth. So now that we've done that, we're going to start palpating so we palpated the head. Now we're gonna go down to see check to palpate the lymph nodes. So we're gonna go here. Do you have any tenderness?
No.
Okay, and I don't feel anything, so that's good. Now we're gonna feel right here. Any tenderness?
No.
Okay, perfect. Now we're gonna check here the mandibula. Could you please open? And then close, and then open, close. So we don't have to feel like the mandibula popping. And then now we're gonna we're gonna palpate the sinuses. Do you feel any tenderness?
Mm-mm.
So everything's good. We also palpated here, the lymph nodes. And after we have palpated for the lymph nodes, and then we are gonna go over just everything. So now we're gonna go start with the nose again. Sorry. So we're gonna go down to feel the nose bridge. Do you feel any pain? So it's midline, and then also no drainage at all. And then we're going to check for the trachea as well. Do you feel any tenderness?
No.
No. And then it's also when we check, we see that there's no it's symmetrical with her nose. So now that we have palpated the trachea, we're going to go ahead and palpate both carotid pulses as well. And we shouldn't. Do you feel any tenderness, anything at all?
No.
Okay, so now we are going to check for the thyroid. So I'm going to go back, and then I'm going to kind of like go to the base of the trachea, and then I'm going to move it. And then I shouldn't feel anything. Do you feel tenderness or anything?
No.
Okay, so now that we have checked the thyroid, we're gonna listen to the carotid pulses, and I'm going to have my patient holding your breath, and I'm gonna listen to it with the valve. So, could you please hold your breath? Okay, so when I'm listening, I'm looking for any abnormal findings or any. I hear the S1 and S2 in the preview, and then everything is good. So I'll document that. We are going to also do a hearing assessment that we'll do the whisper, or we can just kind of do this to see if she can hear it. So I will go. Here, and we'll just. Do you hear anything?
Yes.
Oh, okay. Where do you feel it? Right or left?
Right.
Okay. And then here.
Yes, I do hear it on
Okay,
the left
okay.
side.
So this is just to see it's a hearing test, and then we'll do the tuning fork hearing test. That's like the vibration, and then we have the Weber and the Rennie test with a tuning fork. So we'll place the the Weber will go on top of the head. So it is just to we'll put it on top of the head, and she would have to listen or feel the vibration equally, right and left side. And then for the Weber, we'll just put it on the mastoid bone right here. And same thing, she would like right behind the ear, and then she would see that she will she should be able to tell me when she stops hearing everything, the noise. So now we're gonna go over the cranial nerves. For the cranial nerves, we're gonna have a patient. Could you please smile? Okay, now we're gonna crunch up the forehead, and then now we're gonna just close your eyes very tight, and then would you please just puff up your cheeks? Okay, and then your tongue say Okay, perfect. So now we check for the cranial nerves, and we're just going to now go over the extremities and compare left and right. So now we're going to go ahead and do the arms. So they both look symmetrical, left and right. And then we're going to just inspect in general for color of her skin color matches her ethnicity. And then we're going to look for any skin breakdown or bruises, bleeding. And then we're going to also kind of like see that it should be dry and warm, and then she shouldn't feel any tenderness over the extremities. And then we're going to check for pulses as well. We're going to check the brachial pulse with my stethoscope. I can go ahead and check for the brachial pulse, and then I'm sorry, yes, the brachial pulse, and then the radial pulse. So the brachial and the radial pulse, we're gonna check both of them, and we shouldn't be hearing any abnormal findings. We're also going to check, now that we are here on the hands, for capillary refill, and these go back within a second, so that's good. We're going to also check for the skin turgor, and then everything is good, you know. So when we go over the extremities, we're checking for edema. So same thing when we go at the upper extremities and lower extremities, we going to document if we have any non-pitting edema, and then it should go back to the normal skin, how it looks within a second, and we should grade it and everything. So now we're going to go ahead and please grab my hands and then pull it, and I'll push it, and then we'll this is for the to see her strength. And now I'm gonna have my patient, can you please move your arms like up, and then go down, and then go right, and then just moving, just sorry, and then moving, moving the arms, and then same thing we're gonna do when we go over the extremities down the line. And then we're going to we're gonna do a chest assessment now. So we're going to inspect the same for any bruises, bleeding, any abnormal finding, and then we are going to auscultate. So we're going to go ahead and first start with the our aortic pulse. So we're gonna go here, and then we're gonna start with the aortic, and then we're gonna go to the pulmonary, then we're gonna go down to the Ayres point, and then we're gonna go down to the aortic, pulmonary, the tricuspid or tricuspid, and then we're gonna go and then ask the patient to go to the fifth intercostal, the fifth intercostal, and then we're gonna kind of lift it up, and then and listen for the apical pulse for 60 seconds, and then after we have done this, we haven't found any abnormal findings. So now we're gonna go ahead and to go listen to the lungs. So we can go ahead and just start here, and then we go right here where the above the clavicula. And then can you please take the practice? And lift it up. And we can just keep going. Oh no, no. And then we're gonna go to the back. And please breathe. Take a deep breath. Down. And then I listen to her lung sounds, so they're clear to auscultate, no abnormal findings or any crackles, or shingles, anything like that. We'll document that as well. Now that we've done that, we're going to go ahead and go do an abdominal assessment. So we're going to have our patient lay down if possible. We're going to inspect for any abnormal findings, for skin breakdown, or anything that's would not be normal. And then I'm going to auscultate all quadrants, and then also the pulses, and then make sure that we percuss and palpate. We're going to palpate all quadrants, and also a deep palpation, so we're going to go down deep. Do you feel any tenderness or any discomfort?
No.
Okay, so when have you had your last menstrual cycle?
Last month on the 20th.
Okay, when was your last bowel movement?
Yesterday.
Okay, how would you describe your bowel movement?
As regular, soft.
Okay, perfect. So now we'll document that, and we're also gonna go ahead and auscultate the pulses, the femoral pulses, the popliteal pulses, right behind the knees, and then also we're going to check for the pedal pulses and the posterior tibial pulses. And so we're auscultating, and then we go popliteal, and then we go down, and we don't see any abnormal findings. So now that we've done that, we are here down the feet. So we're gonna check for edemas, and then I see there's no pitting edema, there's no edema, so that's good. We also check for skin breakdown, color matches her ethnicity, and do you feel any pain while I'm no pain. And then I'm also checking for capillary refill in her nails. Same thing with like a skin trigger. And then also when we're going over the assessment, we just make sure that our patient doesn't feel any pain, and that will be all for my assessment. Thank you.